Nutritional and food requirements of infant. So growth and development for the entire human life. Okay, the growth and development which we witness when a human being is in their infantile stage. Okay, that's the most rapid growth which we witness in a entire human being's lifetime. Okay, so it's very important, especially do you know the difference between newborn and infant? Can anyone say in the chat box? Will you admit the infant if any infant has some disorders, critical stage? Will you admit the infant in NICU, neonatal intensive care unit, or pediatric ICU? uh, Newborns are from birth up till the first month. Okay, from birth up till the first one, only those children will be admitted in the neonatal ICU. Okay, as soon as a child is over, as soon as a newborn has completed the first month of their life, they will be in the PICU. Okay, they will be in the pediatric ICU. 2-month old baby will be in the pediatric ICU. 1-month old baby will be in the neonatal ICU. That's the difference between newborn and infant. Okay, the infant period of the life will start from second month up till the age of 1, then you are toddlers. But newborn, when we are talking about with respect to hospitals, there is a clear cut difference between that. Okay, newborn up till the age of infants, or also like the food, when we talk about breastfeeding, we will include the newborns also, but strictly from the hospitals and the medical point of view, there should be a clear cut demarcation between newborns and infants. Okay, up till the age of 1 month, a human being is considered as a newborn. After that, it's infant up till the age of 1. After their first birthday, up till the age of 3, till the third birthday, they are toddlers. Okay, then they are preschoolers, schoolers, adolescents, etc. It goes on like that. Okay, so whenever an infant is in a critical stage, first understand in which age they are. Are they 1 month old, or beyond 1 month? If it is beyond 1 month, they will be admitted in the PICU. Okay, so as we have discussed earlier, most rapid growth of the entire human being's life. Okay, the most rapid growth is witnessed when they are born up till the age of uh, 12 months or 15 months. Okay, 12 to 15 months. So the entire infancy, you will witness the most rapid growth. How it is possible? Because a healthy newborn will weigh around 3.2 kg. This weight is given by World Health Organization. Okay, that's the correct weight of a healthy newborn. Obviously, there is a range also. A newborn who weighs less than 2.5 kg, we consider them low birth weight. Okay, so there is a range for that to be in a normal birth, but a healthy newborn is around 3 to 3.2 kg according to WHO. It is given in the textbook. Just refer this value. Okay, so this 3.2 kg will be doubled when the child reaches 6 months of age. Okay, so that's the amount of growth which we are witnessing, and triples by the first year. As soon as the child becomes 1 year old, on their first birthday, if you want to keep a track of your child's health, okay, remember at the time of their birth, what was their kilogram. 6 month, what's the kilogram? Has it doubled? It should be double. Okay, then only you can say you are having a healthy 6-month-old baby. Okay, and it should triple by the first year. So this is the growth and development we witness during infancy. And also when we come across to the body concentration of water and fat. Okay, 75% it is water in a at birth. Okay, in a newborn, their entire body has 75% water and 12 to 15% fat. But at the end of 1 year, as they grow and they are near reaching around 1 year of age. 60% will be water, and the fat increases by 24%. Okay, if the child is exclusively breastfed, well fed, weaned on time, this is the rate of growth which we should be witnessing. Coming to the nutritional requirements, based on the RDS given by ICMR for the Indian infants, okay, the energy requirement on a daily basis for an infant is around 92 kilocalories per kg body weight. Okay, now, the child usually born to an average health wise average mother, not malnourished, but a relatively healthy mother, the child's weight will be around 2.5 to 3. Okay, not more than that. If the mother is well nourished, okay, and she's overnourished, okay, in that case you can expect a baby beyond 3.5 kg at birth. Okay, so given what is the body weight of the child, depending on that amount of calories should be fed to the child. Okay, and this should for the first 6 months exclusively breast milk should be given, no water, no honey, nothing. Okay, we will discuss that later. Then the protein also when it comes to energy, always remember, as soon as the infant will start to crawl and walk, okay, we have to make sure that their calorie requirements is met. Okay, as soon as you see these childhood milestones like crawling, bending over on its own, okay, trying to walk, holding things and standing up, when you see these kind of actions done by the child, make sure whatever you're feeding your child, it has to be increased a little bit, because they require additional calories to keep up with these activities. Otherwise they will not gain adequate body weight. Okay, and 70% of the calories will be given by milk alone. After that, the remaining percentage of calorie you have to give the child supplementary food, especially after 6 months. You will see this crawling, bending over, sitting on its own, all those kind of milestones you will see after the 6 months of age. You will find all these things. At that time you have to make sure your supplementary food are enough, because milk cannot give too much of calories at this point. Only 60 to 70% of calories will come from mother's breast milk. Otherwise you have to incorporate other supplementary feeding techniques, weaning food you have to incorporate, so that all the calorie requirement is met. Protein 1.16 gram per kg body weight, depending on the child's body weight. Okay, multiply the body weight with this number, you will understand how many protein should be fed to the child. Usually to keep an track of this amount of protein, this amount of calorie, energy is very difficult, because if the mother is able to successfully breastfeed the child, and the child doesn't require any artificial feeding, okay, in that case it is quite difficult to keep exact track. But on a positive note, breast milk will take care of all these requirements. If the mother is healthy, if the mother is well nourished, the breast milk will take care of all these requirements. After 6 months only you have to keep up a little bit track on the vitamins part, proteins part, okay, etc. Up till 6 months, if the mother is well fed, well nourished, the breast milk can take care of all these requirements. And the protein content in human milk is around 1.1 gram per 100 ml. Okay, human breast milk. So it is more than enough to provide the required nourishment for the child. The protein requirements will be given by the milk alone up till the age of 6 months. Fat and essential fatty acids, 19 gram per day of visible fats. Can anyone just revise what do you mean by visible fats? Not the new admissions, the previous batch students. If you remember what is visible fat and what is invisible fat. Yeah, oil, butters, the fats and the oils which you buy as it is, as it is in the form for cooking purposes, etc. And can you incorporate visible fat before 6 months? No, you cannot. Okay, so this 19 gram per day of visible fat, understand it, even if it is not given in the textbook, it is for the kids who are above 6 months of age. Okay, before 6 months, no need to worry about it. The fats and essential fatty acids are given through the breast milk. Calcium and phosphorus, even yesterday we discussed on this part. 1 is to 1.5 is the ratio. The same, calcium and phosphorus, 500 mg of calcium, 750 mg of phosphorus. Calcium and phosphorus rich food can be given, incorporated after 6 months. Up till that, don't worry about it. Iron, 46, till the, as soon as the child is born, okay, in its liver and in its bone marrow, if the mother during her pregnancy she had enough dietary she had enough iron in her diet, and if she already had any iron supplements or she incorporated iron rich food during pregnancy, it is complete, you can guarantee that the child's liver and child's bone marrow will have enough iron store for the use of its RBC building capacities up till the age of 6 months. After that, you have to incorporate, make sure that iron rich foods are given. Okay, if the mother was anemic during pregnancy, then the story is different. Then you may have to start some additional feeding techniques. Okay, you have to correct the mother's iron deficiency, especially when she's lactating. That kind of treatment has to be given. But if the mother was not anemic during the pregnancy, no need to worry about the child's iron stores up till the age of 6 months. Then zinc, sodium, iron, these minerals are provided enough by the breast milk. And even when you are weaning the child after 6 months, you don't have to compulsorily put too much of salt in the weaning diet. Okay, salt has to be on the restricted side. Also sugars, okay, sugars and salt has to be on the restricted side until and unless it is contraindicated. Vitamin A, mother's breast milk has enough amount of vitamin A that will be sufficient. And after 6 months, you can start, if you are into a non-vegetarian diet, you can start introducing egg yolk. Yolk can be introduced into the child's feeding diet. And if you're a vegetarian, you can incorporate yellow, orange fruits and vegetables. Puree of yellow, orange fruits and vegetables like mango, papayas. Okay, just mash these fruits and you can feed the child for vitamin E. So if by vitamin D you can't supply, because neither the breast milk, human breast milk, or the cow's milk has vitamin D. Okay, it doesn't have enough vitamin D to prevent rickets. So what you can do here is, when the mother is pregnant, at that point of time, if she has enough, she doesn't has vitamin D deficiency, that can help in the satisfactory development of her infant. Otherwise, you have to take treatment methods after birth. Vitamin K, as soon as the child is born, vitamin K injection is given. Okay, because we have to prevent any kind of hemorrhage. Vitamin K is a very important clotting factor when it comes to blood and any wounds. Okay, so as soon as the child is born, in the labor room itself, a vitamin K injection is given to the child. 1 mg of water miscible vitamin K is given. It overdose cannot be given, that will be quite harmful. So that nutritional consideration is met as soon as the child is born. Even in the immunization schedule, if you have seen the immunization schedule for kids, universal immunization schedule, most of the commonly used schedules do mention vitamin K also at birth. Along with BCG, vitamin K is also mentioned. Then coming to vitamin D, it is very rare to find a child who will be deficient in vitamin B, because the thiamine requirement is completely given by the breast milk. It is no deficiency of vitamin B or B complex is found in the infants. It is very rare. Vitamin C, initially, especially when it comes to colostrum and all, we will discuss about that stages of breast milk, that has enough storage of vitamin C. But as soon as the mother's milk get matured after few months and all, milk is not a good source of vitamin C. So in that case, as soon as the child crosses the 6 months of age, fresh fruits, raw fruits has to be included. Okay, puree of raw fruits, fruit juices has to be incorporated. Never cook any kind of fruits or anything and give raw fruits puree or in the juice form without adding sugar, has to be given to the child, so that don't go into the state of vitamin C deficiency. The nutritional assessment, we can also call it as anthropometric measurements. In pediatrics, that's the terminology that we use. Okay, so when it comes to the pediatric anthropometric measurements, weight, length, head circumference, mid-arm circumference, arm circumference, that kind of different measurements are there to understand if the child is malnourished or not. If you remember, those who have attended the class on severe acute malnourishment, okay, if you remember that mid-arm circumference, etc., we have discussed, we have covered through. So that is one kind of anthropometric measurement. Okay, these kind of assessment is done to identify malnourishment in the initial stages itself and correct it then and there in growing children. So coming to breastfeeding. So as soon as the child is born, soon after the birth, within half an hour of normal delivery, okay, breastfeeding has to be started. Okay, and if the mother had C-section, do not delay more than 4 hours. Okay, in a cesarean section, you can start the breastfeeding within 1.5 hours, and by 4 hours, within 4 hours, the child should be on breast and suckling has to be started. Okay, even and some in some cultures, what they do when the child is born, and when the nurses take the child out to meet the family members, etc., some of them will feed the child honey and water. Okay, so what it does is it will satisfy the thirst of the baby. Okay, but while doing this, you should not do that. Okay, should not put anything in your child's mouth other than the mother's breast milk, because if you're providing the child water or honey or anything, any pre-lactal food, okay, before you give the child breast milk, the child will not have the strength, okay, to completely suck at the breast milk and suck the breast milk in. Okay, so because as soon as the child is born, the sucking reflex, okay, suckling reflex, that's what we call, uh, that is highly active, and that is active because the child is ready and thriving to suck on the breast and to rectify its thirst and to meet its nutritional requirement. Okay, so that's the reason why avoid prelactal food. Do not give the child even fresh water, honey, or any other thing which is culturally used. Do not follow that. It is scientifically incorrect. Only mother's breast milk should be given, and this is the time span within which breastfeeding should be started. Even if the mother is sedated, breastfeeding can be started. Okay, so it has many importance, not just for the child but even for the mother. We will see that later, how it affects the breastfeeding affects the child's health as well as the mother's health, or even the long-term health. We'll discuss that later. So coming to breast milk, the first few days, the first 2 to 3 days, the breast milk which comes out with that is what we call it as colostrum. Okay, it is yellow orangish colored liquid, quite thick liquid, and then we get transitional milk. Transitional milk will be secreted from for the next 2 weeks after colostrum, 2 weeks. transitional milk will be secreted, and after that, within a month, mature milk will start secreting. And in mature milk, you have foremilk and hindmilk. Okay, foremilk is a clear bluish colored liquid, and clear milk, usually what it does is it will make sure the baby is not thirsty. Okay, the baby's thirst is satisfied. It doesn't have much protein, carbohydrates, lactose, or anything. Okay, it is maybe the majority of the foremilk consists of water to satisfy the baby's thirst, and then after few minutes of foremilk will come hind milk. Okay, hind milk is quite rich in fat, carbohydrates, and all the proteins, etc. So the initial first few days of after birth, colostrum will be secreted. Then you will have transitional milk, and then finally you will have mature milk. Okay, in mature milk you will foremilk will be the first form of milk that will be coming out. The water content is much more in foremilk, and later hind milk will be following. So these are the consistency of colostrum, and how its colors are, what are the contents. Okay, color of the colostrum is yellowish creamy. It is high in protein, fat, soluble vitamins, minerals, and immunoglobulins. Main thing to remember here is colostrum is rich in immunoglobulins. Transitional milk, that is high in fat and lactose and water soluble vitamins. It is high in calories also. Mature milk, foremilk and hind milk. Foremilk, which comes first, low in fat, high in lactose, sugar, high in water, minerals, and vitamins. Hind milk, which comes late. Okay, richer in fat, calories, and less in sugar. So for growth, the main thing when you have to witness here, even when the mother is exclusively breastfeeding, if you don't see enough weight gain in the child, it means that the mother is shifting the child from one breast to another breast. Okay, it means that before the hind milk starts secreting, she is changing the baby to the other breast. Okay, so in this case, you have to give the health education to the mother that make sure you keep the baby on one breast only for the entire feed, so that the child gets the foremilk, the thirst is satisfied, as well as after the foremilk, the child also sucks onto the hind milk, so that the nutritional requirements are met. Okay, so that kind of education you have to give to the mother to keep the child on one breast only for the entire feed, to prolong the feed on one breast only. And then even if the child is not satisfied and you feel tenderness and uneasiness on the other breast, then you can change the child to the next breast. So that kind of education has to be given. So this is how it looks the first few days of colostrum. uh, these 5 days and 6 days, these both are transitional milk. Okay, the first image only, that is colostrum. You can see how mature milk differs from colostrum. The last one, 25 days, here the mature milk has started to be secreted. Okay, so this is how visually it looks different. Okay, so coming to the advantages of breastfeeding. First, nutritional benefits. For that, those who have the textbook, okay, there is table 4.3 and 4.4. Okay, especially table 4.4 is much more important. It has a comparison between human milk and cow's milk in all the majority of the nutrients which we are looking for, that is proteins, fat, and carbohydrates. How human milk differs from cow's milk in from a nutritional point of view. Okay, for nutritional benefits, how much of carbohydrates, proteins, vitamins, lipids, etc. should be there, these two table will give you the information. Okay, so just go through that. No need to by heart it, just understand the concept of these two tables. Okay, table 4.3 and table 4.4 on page number 60. So human milk, when it comes to the nutritional benefits, because of carbohydrates, okay, human milk is so rich in carbohydrates that it is considered sweetest milk because of its high amount of lactose. And protein, 1.1 gram of protein is there in 100 mg 100 ml of human milk. Lipids are also present in form of unsaturated fat. Essential fatty acids is also present. Prostaglandin precursors, fat soluble vitamins, steroids, phospholipids, cholesterol. Okay, these are present in the human milk. Enough amount, what the baby requires, that amount of calcium, magnesium, phosphorus, iron, copper, zinc, sodium, potassium is there. Minerals in the breast milk is just enough for the child. The child doesn't require any extra additional minerals apart from up till the age of 6 months. After that, you can incorporate supplementary food, and those requirement can be fulfilled. So hormones and growth factor. The human breast milk is rich in thyroid stimulating hormone, TSH, thyroxine, parathyroid hormone, corticosteroids, calcitonin, uh, erythropoietin, oxytocin, growth hormone, releasing factor, insulin, and prolactin. So, what all hormones are available in breast milk? It is given on page number 63, last second paragraph. Okay, just go through that. So, immunological benefits. This is important. Macrophages are available in the breast milk. Macrophages will engulf the bacteria. Okay, if there is a bacterial attack or viral attack, it will completely engulf and digest the bacteria, kill it off. And it is also involved in synthesizing certain proteins, which will further increase the immunity in the human being. And then it has lymphocytes, T lymphocytes and B lymphocytes, both are present in human breast milk. Then immunoglobulins, this is important. IgA, immunoglobulin A, immunoglobulin G, immunoglobulin M. These three immunoglobulins are rich in breast milk. Especially IgA is in large quantity as compared to IgG and IgM. Okay. All these immunoglobulins will play a major role in defending the child against viruses, bacteria, any other pathogens, toxins, etc. Okay. Then human breast milk also has lactobacillus, the good microbial flora which is present in your stomach. Okay, it converts the milk into curd, which can be completely easily digested and processed in the small intestine of the child. Okay. Then psychological benefits. The child feels more safe and secure, especially when it is breastfeeding and it is so close to the mother. It can feel the mother's heat and warmth. So the child will automatically feel very safe and secure when, especially when the child is breastfeeding. And also even for the mother, it is a very unique process. If you're a woman, you can understand it's a very unique process. There is no substitute for that particular process and that particular time which you share with your infant. Okay, so it has a psychological benefit for the child as well as the mother. Economic, breast milk will not cost anything. It is even though the mother's requirement is increased, because when you're a lactating mother, your requirements, nutritional requirements, is much more than a average healthy adult woman. Okay, so even though the mother's requirement is increased, but the benefit that the breast milk can give to the child is far more economical. It will keep the hospital charges so low that the child will not have any early infantile infections, any inflammatory diseases. Okay, just because the child is well fed with breast milk, lots and lots of diseases are kept away from the child. So in that case, you can save the hospital expenses. Okay, and also if you do not breastfeed the child and you depend on artificial feeding, that comes with a cost factor. Artificial and commercial preparations are very expensive as compared to how much you can save with breast milk. Because when you're doing an artificial feeding, okay, you're using a milk substitute from outside, you are not just paying for that, but you also have to put your money in sterilizing the bottles, the spoons, the feeding bowls, etc., what you will use to help the child to get the nutrients inside. Okay, so that has to be sterilized on a daily basis, and that comes with a cost. So there are so many disadvantages of putting the child off of a breastfeeding schedule. Okay, so it is, breastfeeding is considered much more economic. Infant and child morbidity and mortality both has been seen. It has markedly reduced when a child is breastfed exclusively for 6 months, because all the diseases are kept away. Okay, the child is not prone to a lot of infections and inflammations. Automatically, the morbidity rate will reduce. Development of child, DHA is present in breast milk. That is important. You can underline that part in the mental development. Last paragraph, DHA is present in the breast milk. It is essential for your nerves to divide and spread out through the body. IQs, the exclusively breastfed kids have shown much better IQ levels and IQ scores than the children who are not breastfed. And there are other advantages also from page number 66 to 67. In simple statements, they have mentioned few points. Just read through that, you will understand. Like the child who is putting the force into sucking the milk out of the breast, automatically their jaws are working. Okay, so that makes sure that the child has a fully developed teeth and it has a very strong jaw. Okay, so the facial features are quite good when this kind of exercise takes place continuously for 6 months for the child. Okay, and it is even if you're giving the child some formula feeds, if you by mistake you give the child a wrong formula or you overdose the child with formula, that will be much more harmful for the child. So when it comes to breastfeeding, you don't have to worry about all these things. Then coming to the environmental benefits, breastfeeding is a natural resource, and with every pregnancy, automatically the mother will breastfeed. So you do not require any shipping or any packaging or anything which comes with an environmental expense also. So it is completely a natural source of energy and nutrition which you are giving to the child without putting any environmental pollution or putting any environmental resources into exhaustion. Okay, so it is also when you are breastfeeding, exclusively breastfeeding, the woman will not be able to conceive the second child because the ovulation is delayed, as well as the menstruation will be delayed. So in that case, there is a good chance of birth spacing, and thus limiting the population growth, etc. So that's how it affects the environment in whole. The advantages for the mother, immediate advantage is uterine involution. Uterine involution is a medical terminology. It just means that when a woman is in a pre-pregnant state, okay, when a woman is not pregnant, her uterus will be of a size around 80 to 60 gram, 80 to 90 gram, something like that, or sometimes 70 to 80. The range may differ. Okay, so just take let's say the uterus pre-pregnant uterus is around 80 gram in weight. Okay, but do you have any idea what will be the weight of um, a pregnant woman's uterus when she's in full term? Okay, after 9 months, just imagine what will be the weight of the uterus, only uterus, excluding the fetus, excluding the placenta, excluding the fetus. Anyone from the medical background? It is more than half a kg. It is close to 1 kg. Okay, near to 1 kg in a healthy full term pregnancy. As soon as the woman reaches the 9 months plus 1 week stage, okay, 38, 37, 38 stage of pregnancy, at that time, yeah, it is 800, close to 1000 kg. Okay, not 1000 gram, that is 1 kg. It is close to 1 kg, but not exactly 1 kg. Differs from individual to individuals also, but it is definitely more than half a kg. Okay, so just imagine the uterus going from 80 gram, somewhere around 80 gram, to near to 1 kg. Okay, how much of expansion has took place, and this expanded uterus has to come back to its pre-pregnant size. Okay, it will not exactly come back to the 80 gram as before pregnancy, but it will be reverting back to around 85 to 90 gram in size. Okay, so in that case, the uterus has to snap back to its normal size without any issue. Okay, and with breastfeeding, this uterine involution is accelerated. Okay, within 42 days after birth, the uterus should completely go back to the pre-pregnant state, but most of the involution takes place within 10 to 15 days after birth. Most of the 80 to 70 70 to 80% of involution takes place at 1 to 15 days after birth. Then slowly the remaining involution will take place within 42 days after birth. Okay, so that's the numbers which we are seeing. So that's how important breastfeeding is to the mother's health. And reduced bleeding, we do episiotomy, etc. Certain procedures are done during the birthing procedure. So with the breastfeeding, psychologically, it makes sure that bleeding is reduced infection, lactational amenorrhea. Lactational amenorrhea means absence of menstruation while lactating. Okay, as I told earlier, when you are breastfeeding, you will not be witnessing periods, at least till exclusive, especially when you are exclusively breastfeeding. You will not be witnessing periods up till the 6 months after birth. 6 months, sometimes it goes to 9 months or 1 year. So that lactational amenorrhea will make sure that even if there is a sexual intercourse during these periods, and there are high chances of the woman getting pregnant, but if she's exclusively breastfeeding and giving breastfeeding to her child, even when the weaning diet has been incorporated, it makes sure she has a natural contraception against unwanted pregnancies. Then reduced adiposity and weight. Adiposity means large number of fatty tissue. As you know, when you get pregnant, your body changes a lot. You gain a lot of weight. So to lose that weight, the best way forward is to lactate, okay, as much as possible. Put your child on breastfeeding, and then it will reduce the postpartum depression. That's a psychological disorder. Some women do, most of the women do go through this. Some have it harder than others. Okay, there are many cases in which after childbirth the women try to take their own life because of this postpartum depression cases. Okay, it has happened in the past. So it's not something mythological, it's very real. Okay, postpartum depression do exist. It hits some women harder than others. Okay, especially the women who have a very strong and supportive family to take care of the needs of the child and to take care of the mother's needs also. In that case, the symptoms are very less. But women who are left alone after pregnancy, after giving birth, doesn't have a much supportive family. Okay, and especially other social factors, like especially in India, if you are giving birth to a girl child in a rural area, okay, the kind of stigma you may have to go through. Okay, there are certain female feticide cases also that will also share into this postpartum depression, etc. So that's a very real thing, it does happen. Reduces stress and anxiety, and there's an improved body image. In long term, how does breastfeeding help? Can the risk of cancer, especially breast cancer, ovarian cancer, and endometrium cancer. Endometrium is the inside lining of the uterus. So every month when you menstruate, endometrial lining is the one that is coming out, which is being shed out from the uterus. Okay, so in some cases, people do have endometric cancers, etc. Endometriosis. Um, Growth of this endometrial lining should be found only within the uterus. If you find this endometrial lining somewhere else, okay, in the ovaries, in the fallopian tubes, in some severe cases it is found even in the intestine. Okay, so that's what we call as endometriosis, abnormal growth of endometrial tissues outside the uterus. Okay, so these kind of disorders, female reproductive disorders, can be reduced. Diabetes, risk of diabetes can be reduced. Osteoporosis, blood pressure, cardiovascular diseases, any metabolic syndrome, like lactose intolerance is a metabolic syndrome, rheumatoid arthritis, Alzheimer's, and multiple sclerosis, etc. These are the long-term benefits of breastfeeding. So breastfeeding during illness. Can you breastfeed when you are sick? Can anyone just guess the answer in the chat box? Can you breastfeed when you're sick? Can a woman breastfeed when you're sick? Yes, if you are taking a proper medication for your illness, whatever your illness is, okay, you can continue your breastfeed. No need to stop the breastfeeding process just because you are ill or you have an infection. If you are properly taking your treatment, if you are being treated, breastfeeding can be continued. Okay, there are certain contraindications for that. If you are taking certain specific medications, we will discuss that later. That is coming up. There are certain specific medications. If you are under the treatment of those specific medication, you have to halt your breastfeeding. Okay, and you can make your child depend on breast milk bank. Okay, that is for only special case scenarios. Okay, special medications. Otherwise, you have a small infection, any small inflammation, if you are treating yourself, you can still continue your breastfeeding. So it is discontinued only when contraindicated, especially when the child has certain gastrointestinal problem, some inborn metabolism. Okay, inborn errors of metabolism. In that cases, breastfeeding will be contraindicated. In case of AIDS, when the woman was uh, is suffering from AIDS and she gave birth to the baby, um, if the baby doesn't have anyone else to take care of, okay, there are no social worker or there are no other family to support the care of the child. Only in that case, breastfeeding can be continued because HIV is transmitted through breast milk. Okay, especially um, always remember this thing. When a mother who is diagnosed with AIDS, when she gives birth to the child, from the first feed itself, if you are giving breast milk, continue that. Do not introduce um, substitutions or infant milk substitution in that case. Okay, but the mother is having AIDS, she gave birth, and you don't want the child to uh, get the HIV infection, so you started giving the child formula feeds. Okay, artificial milk substitute, etc. After that, the mother should never give the child breast milk, because what happens is that breast milk is very easy on the child's intestine. Okay, child's GI tract, gut, for the child's gut. Breast milk is very good. Okay, it will not put any stress on the child's gut. But if you are giving the child any artificial feed, okay, there are chances that the child's intestine and gut can undergo small wounds, small eruptions, or small reactions. And when the internal lining of the child's intestine is compromised, gut is compromised, and after that you introduce breast milk, there are high chances that the child will get HIV infection. That is why once you start artificial feed, do not go back to breastfeeding when it is a case of AIDS. Okay, if you have started breastfeeding, continue that, because you can ensure that the child's internal lining is intact. There is no internal wounds. There is no stress in the child's gut. In that case, continue the breastfeeding. Also, when there is no one else to take care of the baby, of the AIDS patient, in that case also there is no other way. Breastfeeding has to be continued. Okay, so that's the contraindication here. Why you can feed even during illness, it is because breast milk is the most easily digestible food for the sick baby, and it is the best pacifier for the child. This is how a pacifier looks for those who don't know. Okay, you must have seen that to keep the child quiet, to keep it from crying, mothers and parents would depend on pacifier. There is a disadvantages of this because the child will be stuck on the oral stage of um, psychosocial development. Okay, that is the psychological aspect of it. But yeah, it is commonly used to keep the child occupied, to keep the child from crying. Okay, so this is pacifier. So breast milk is the best pacifier of all. It meets all the nutritional demands, and also it gives immunity. So this is the reason why breastfeeding can be done even when the child is sick or even the mother is sick. So Infant Milk Substitute Act 1992, in the World Health Assembly in 1981 itself, they had passed this act. But when it came to India, it took quite long. It took 10 years to reach India. So in 1992, this act was passed by the Indian government, and by August 1993, it was in action. So what this act does is, earlier when television was being introduced to each and every household, there was a lot of marketing, etc., done. Even in hospital levels, marketing was done of these milk substitutes. Uh, can you give me any examples of very well-known milk substitutes? If the child cannot be put on breast milk, what substitutes do you give? Any common name, brand, etc.? Yeah, Nan Pros, Isomil, Lactogen. Yeah. So the thing this Infant Substitute Act does is, you can't do marketing for these things, these brands. Okay, marketing should not be encouraged, especially in any healthcare facility. You visit any maternal or child healthcare facility, you will not see posters or any marketing for these infant milk substitutes. Okay, because what happened was, when these lactogen, nanpro, isomil, and different country has their own brands, etc. So when these things were marketed, it was quite easy for working mothers to shift from breast milk to these infant milk substitutes, but they were not aware of the disadvantages of these things. So that is why this act made sure that the production, supply, distribution, and even the marketing of these substitutes is regulated. Okay, no hospital, no clinic, no maternal healthcare center has the right to put out a poster of any of these substitutes, even if these brands pay you well to talk about the even the doctors, the gynecologists, obstetricians, pediatricians, the healthcare workers are refrained. Because of this act, they are refrained from talking about certain brands, talking about certain infant milk substitutes, until and unless it is indicated. The child has no other way of getting nutrition, because the mother is not there, or the child has some inborn errors of metabolism, some disease conditions, some gastrointestinal issues. Only in that case, only when it is indicated, you can give milk substitutes. Otherwise, breastfeeding is the only thing that is encouraged. So that is what this act does. It provides the regulation for the production, supply, distribution for infant milk substitutes. Especially if you want to open a company of milk substitutes, it is much more difficult to enter for you in the market. Okay, you have especially infant milk substitutes, they have a lots of clearance procedures. Okay, you can't just go open a brand and open a lactogen or an antro derivative or something like that. Okay, government has a very strict regulation for its production as well, to protect and promote breastfeeding and ensure that there is a proper use of infant foods only when required, only when indicated. Otherwise, exclusive breastfeeding should be carried out. It prohibits the promotion of breast milk substitute products on the pretext of distributing of educational and informational material. Means you can't even share or distribute pamphlets about these products. That's how the law is. Even sharing pamphlets or any brochures about these products is prohibited within the hospital premises. Next, coming to the issue of low milk production. Usually all the mothers, they have enough milk, but they always doubt themselves. They have that, I'm not producing enough milk, that is the reason why my child is crying, my child is irritable, it is always hungry, because I'm not producing enough milk. That is the kind of confusion most of the mothers will have as soon as they have delivered the child. Okay, some children have this problem of suckling reflex. They can't latch on to the nipple, and their suckling reflex is quite delayed. Okay, in that case, the mothers may feel like they are not worth breastfeeding, etc. Okay, such kind of negative feelings can creep into them. Okay, so it's the most common thing, and it is the most common reason why mothers will give up breastfeeding, just because they will think that I can't produce enough breast milk, so why should I waste my time on it? I should put my child on formula feeds. Okay, so that's a common myth. But usually, as healthcare workers, you have to reassure the child, sorry, you reassure the mother that they have enough milk. Usually, all the mothers will have enough milk. It is a very rare case that the mother doesn't produce enough milk. So you have to usually the pediatricians and the obstetricians, midwives, they know the best how to differentiate between a mother who is actually producing less breast milk, and differentiating those mothers from the mothers who have enough breast milk but they think they produce less. Okay, so that kind of differentiation should be identified by pediatricians, gynecologists, obstetricians, and midwives. Okay, it's their duty to do, and then give the mothers proper counseling. Okay, so why does and for those mother who actually have low milk production, what are the causes for that? Some of the most common causes given here: ignoring their own health. Okay, some stress factors will also lead to low milk production. Too much caffeine, too much dependence on tea, coffee, etc. Smoking, taking certain medications like anticoagulants, etc. Stress, not watching your own diet, especially when you were pregnant, you were calcium deficient, you had protein deficiency, other kind of especially a malnourished mother, in that case she will have low milk production. Okay, so that these are the reasons why a person will have low milk production. Otherwise, a healthy individual, a healthy woman will usually have adequate milk production for the child. Then we have breast milk bank. So it is in operation in many of the maternal and child health care hospitals, especially for the child who cannot get milk from their mother. So if need arises, expired colostrum also can be fed to the child, and it has to be stored at 62.5 degrees Celsius temperature. That's the storing temperature for breast milk in a breast bank, breast milk bank. And then the milk is screened for organization. Pasteurization will also take place, and it is not that expensive. Okay, getting a breast milk from a breast milk bank, it is not that expensive. It is relatively cost effective. Everyone can afford it. Um, when it is expressed milk, it can, before it turns into curd, in a room temperature, it can be stored up to 8 hours in a room temperature. Okay, in the refrigeration it can be stored up to 24 hours, breast milk. And if you are freezing the breast milk, it can be stored up to 6 months. So that's how the breast milk bank works. So artificial feeding, when do you indicate artificial feeding? When the child has some congenital lactose intolerance by birth itself, because as I said earlier, human milk is considered to be the sweetest milk among all the other mammals, because it has a high amount of lactose in it. So some kids, they are born with lactose intolerance. In that case, artificial feeding, you have to depend on artificial feeding. Galactosemia, there is that is also an inborn error of metabolism, where the body cannot process how to deal with galactose. Okay, then you have maternal drug intake, when the mother is taking anti-cancer drugs, chemotherapy drugs, anti-thyroid drugs, antipsychotics like lithium, ergot derivatives, iodinated radio contrast, especially some if she has recently undergone any um, radiation therapy, etc. Okay, so in that case, breast milk cannot be given to the child. So artificial feeding is indicated. And in HIV, if artificial uh, feeding is indicated, like after childbirth, artificial feeding has started, follow that only. Do not bring breast milk into the nutrition later on. Then coming to low birth weight babies, LBW, that is a short form for low birth weight babies. Uh, these are the classification. Classification is not given in the textbook, it's just for your understanding. Usually any baby who weighs less than 2.5, they come under low birth weight. Any baby who is weighing less than 1 kg, extreme low birth weight baby. and 1.5 less than 1.5 kg very low birth weight baby. So extreme low birth weight baby is the most dangerous case. Complete they should be admitted in the NICU, in the they have to be given in the incubator system, etc., or under the radiant warmers. These are the things which we use in NICU to take care of the neonates. So the most common cause of low birth weight baby is during pregnancy. If a woman was weighing less than 40 kg by Indian standards, okay, by Indian standards, if the woman is pregnant and she is weighing less than 40 kg during her last term, the last trimester, so that time you can that's a marking that most probably she is carrying a low birth weight baby, or most probably she's going to give birth to a low birth weight baby. So from that point onwards, special care has to be taken care of the pregnant lady. Okay, so pregnancy nutrition is the one main thing that contributes to children being born as low birth weight. And in India, 30% of the babies, that's a huge number, especially when comparing to the Indian population. 30% of the babies born in India are low birth weight. Okay, so and because of this reason, 10 lakh neonatal deaths. It is a child dying before it reaches the age of 1 month. Okay, neonatal deaths is because of low birth weight. So that's the statistics which is mentioned in this textbook, 73 page number. Then you have preterm baby. A preterm baby and small for gestational ages are different. Preterm means from name itself you can understand the baby was born before 37 weeks. Okay, that is preterm. And small for gestational age means the baby was born after 37 weeks. Okay, maybe even at the 39th week or 40th week, but still given to the age of the baby. Okay, at the age of 37 39th week, the baby should be around at or more than 2.5 kg. But even in that point of the time, still the baby is not having adequate birth weight. Okay, so that is what we call it as small for gestational age. Given to their gestational age, they are quite small. They are very light. They are not heavy enough for their gestational age. So that is small for gestational age. Preterm means the baby is premature. Okay, they are born before 37 weeks. So if they are born before 32 weeks, 28 to 32 weeks, they we consider them as very preterm, and extremely preterm before 28 weeks. Okay. So feeding problems in infants, tooth decay, that is most common, especially when you are feeding your child, and after that you have to pat lightly on the back of the child and make sure the child burps. Okay, and before putting the child into sleep, if the child has not burped, or you are giving the child some fruit juices before it goes to sleep. Okay, and the child goes to sleep sucking onto the milk, or sucking onto the milk bottle, and it goes to sleep. These are the factors that will lead to tooth decay in the future. Underfeeding, even if there is a complete emptying of the breast, completely emptied the breast milk, but still the child will have symptoms like uh, very irritable, the child doesn't sleep, the child has constipation, okay, excessively crying. Okay, and these are the symptoms that you can understand the child is being underfed, the breast milk is not enough. Okay, even at the 5 months of age, so in some cases, even at the 5 month of age, the child may start these symptoms. It means that you do not have to wait till 6 months. You can start your weaning at 5 months also, if you see this kind of symptoms. Otherwise, you can wait till the entire completion of 6 months to start the weaning. Then you have diarrhea. Mild diarrhea is very common among children, especially when you introduce new food. Okay, when you have just started the weaning, and especially in that time, diarrhea is quite common. Constipation. if whatever diet you are giving to the child after 6 months, if it is too rich in proteins and too much of fat, okay, even if you're using ghee for the weaning food, there should be a limit to which how much ghee or any other visible fat you should use. Too much of visible fats, that will lead to constipation, etc. Then you have colic. Again, it happens because if you are not using proper feeding techniques, okay, when you are feeding the child, there is a angle to which you should hold the child. The child should not be completely flat, okay. The head should be slightly tilted up, uh, around 30 to 45 degree, like that kind of tilting should be there. Do not feed the child while they are completely flat on the surface, okay. And if you are not adequately burping the child, okay, after feeding the child, where you are not adequately burping the child, what happens, the gas will be stuck in the intestine. And colic is a symptom in which what happens is suddenly there will be a abdominal pain. Suddenly the child will cry from their sleep, or from any position in which they will suddenly cry, and they will be very irritable, severe crying, etc. Okay. And it is because of the stomach pain, sudden stomach pain, because of feeding techniques were not good, burping was not done, okay, and stable emotional environment, etc. That is external factors. Main two things are feeding technique was not correct, and the mother was not doing the burping technique after feeding the child. Underfeeding means breast milk is not able to satisfy the child's nutritional needs, okay. In that case, the child is still hungry, even the breast milk has been exhausted, okay. The child has completely drank the breast milk off, because it is a cycle, okay. Breast milk production is a cycle. In every feed, as soon as the child grows up, this cycle decreases, okay. So in one cycle, the child has completely had the breast milk storage with the mother had, but still the child cries, is not going to sleep. So these are the symptoms that you can understand the child is underfed. Either the mother is also underfed, the mother is not having enough protein or calcium in her diet. That may be one reason. Second reason may be the child needs more nutritional requirement. You will see the underfeeding symptoms mostly when the child is transitioning from 5 months to 6 months. Some children may require weaning before 6 months, so you have to keep an eye out for these kind of symptoms. Even after feeding, even after completely feeding the child, entire volume is completed, still the child is crying, not going to sleep, and very irritable, that means the child is underfed. Weaning is the process during which the infant will change from full dependence on breast milk to a complex independence from it. Complex independence from breast milk means as soon as the weaning started, it doesn't mean you can stop breast feeding. You can breastfeed the child in between the supplement feeds. You can do that, but it weaning doesn't mean completely stop the breast milk feeding and completely go to the food that you're preparing at home. It's not like that. It is a transition, okay, a transition from breast milk to home cooked food, and then completely depending on home cooked foods, okay. So that is what we mean by weaning. So in the Indian scenario, you can take a screenshot of this. It will be useful later. So in Indian scenario, at 4 to 6 months of age, as I said earlier, some children may require weaning before 6 months. So in that case, these are the foods which you can give. Completely cooked, okay, smashed and cooked dal and rice, pureed fruits and vegetables like banana, apple, cauliflower, carrot, etc. Soft to swallow, they can swallow even without chewing. That kind of consistency should be there. Make sure there are no solid hard particles, because there is a tendency of children to choke, okay. So that is very dangerous. And then 6 to 8 months, eggs, khichdi, foods which you can hold, okay, which a child can hold, play with and eat, okay, like that kind of food you can give. uh, Meat can be introduced if you have a non-vegetarian diet. It's not hard cooked meat, but completely soft boiled meat, etc. Puree, porridge, oats porridge, etc. That can be given. Then by 8 to 10 minutes, semi solid foods with texture, uh, fruits, vegetables, paneer, chicken, yogurt, mild spices, juices. Don't introduce any kind of spices up till 6 months. That because that spices will be very irritable for the child's bowel movement. Okay, so spices can be introduced after 8 months of age. Then as soon as the child nears 1 year, okay, nears to its first birthday, food that require more chewing like chapati, okay, dosa, chapati, sambar, soup, scrambled eggs, pieces of fruits, small cut pieces of fruits, that can be given. So other techniques of weaning, types of supplementary food, everything is given in the textbook. Just read through it for your understanding. Okay, no need to by heart any of this. It's a essay type, story type. They have mentioned a few paragraphs. You can just read it for the knowledge. So before going to the problems in weaning, there are certain things you have to keep in mind, especially when a child is on a weaning period. Introduce only one food at a time. Okay, allow the infant to first become familiar with the food before they try to give uh, another food. Okay, first, like for example, if you're starting fruit, you're starting with apple. The first 2 to 3 days, give the child apple, and then go to bananas, carrots, like that. Okay, so slowly you have to make a transition from one fruit to another. Don't give a puree of 2 to 3 different types of fruits together. Some kids may find it non-palatable. Then very small amounts of any food should be given at the beginning, like give the child first breastfeeding and then give a teaspoonful of a fruit puree or any fruit juice. Okay, like that, and slowly increase the 1 teaspoon to 2 teaspoon, like that. Uh, strained fruits, vegetables, and cereals can be given. Fruit juice can be given, not by bottle. Okay. If you are giving any juices, any purees, make sure you give it in from the cup and not using the bottles and everything, because you have to remove the child from the pacifier stage. When the baby is able to chew, that is around 8 to 9 months, gradually finely chopped fruits and vegetables can be introduced. Variety should be given in the food which you give. And if the child has an acute dislike for a particular food, it hates the food, give it a time. For 1 week, give a break, and after that 1 week, try to incorporate that food again. Okay, so in this weaning time is an ideal time where you have to try various choices, because if the child has certain food allergies, it can be identified here. Most of the food allergies that the kids have in this infant age and childhood, usually when they grow up, they overgrow their food sensitivities and allergies. Only in very rare cases it continues in the adulthood, but food allergies and sensitivities are very common in this age, so it's better to have a variety of choice and see, make a note of the reactions of how a child is reacting to that particular food. So use katori, spoon method, etc. Don't depend on bottle feeding only. Wherever possible, use katori and spoon feeding. Yeah, other points are given in the textbook on page number 79 to 80. Simple points. Just keep that in note. Okay, it's very informative. And on page number 80 to 81, there is a table. If a person from a very low economic class are not able to incorporate a variety or a different choices of food, okay, in their diet, for weaning diet, what we can do is there is a low cost supplementary food which is developed exclusively in India. Okay, it is very cost effective. If you give this supplement also mixed with milk or mixed with cow's milk, mixed with water, and feeding it to the child, usually these low cost food will come in powder form. Okay, like Indian multi-purpose food, malt food, balahar, poshak, amrutam, etc. Kerala indigenous food, etc. Okay, so these comes in flour form, okay, the powdered form. You can mix these things in water or milk, and it can be used as a weaning diet. If you do not have access to, cost is a reason because of which you can't have access to, uh, yeah, balamrita. Yeah, that would be available. So no, some examples are given in the textbook, so you can follow that also. So most of these low cost supplementary foods are available in powder form. It can be easily mixed up with water or milk. However, it has been, you can just read the guidelines in that packaging. Okay, and it can be used as a weaning diet. So problems in weaning, some parents, what they do, they will overfeed the child just because they see that the child is accepting the food, and they think that no, the child is hungry, we have to feed more. Okay, so that will lead to obesity in infants. And also when you are trying, when you're on a weaning diet, when your child is on a weaning diet, and instead of using home cooked food, raw fruits and vegetables, you depend on processed food for weaning, that will also lead to obesity. Underweight, too less quantity of food and too less concentrated food which is given to the child, that can lead to underweight infant. Food allergies are an issue. Lactose intolerance. Usually, if a child will be born with lactose intolerance, rarely they will develop lactose intolerance later. But earlier in the life itself, it should be addressed, because even if you are giving child the breast milk, okay, exclusive breast milk you are doing, still the child is not gaining weight. It means the child is lactose intolerance, okay, and intolerant. Also, the child is completely frequently suffering from diarrhea, vomiting, etc., has a bloating, or stomach pain, bloating, etc. In that case, you can make a statement that the child may be lactose intolerant. You may have to shift the weaning diet accordingly. Refusal to take new food. Most of the kids may have this issue. Choking. To prevent choking, make sure that the child's vegetables and fruits which you give as a whole, it is not too big of size, it is small size, which the child can hold in the picker and eat. Okay, too big sizes of fruits and vegetables can choke the child. And make sure there is always someone sitting in front of the child while the child is having the food, even by its own, or whenever you are feeding the child, or when the child is able to eat by its own. In this case also, don't leave the child alone with the food. Make sure some adult is always there when the child is having the food. And there are other kids, as soon as they reach the age of 1, they start walking, running, and they don't like having food, but they will eat food only while they are playing. They run about the house, and they will come have one morsel, then they will run around, come for second morsel. Okay, don't encourage that kind of behavior. The Especially the conversation, talking to the child, allowing the child to speak while eating, these are choking hazards. These will lead to choking hazards. So make sure the child is seated in one place while he or she is having food. Make sure there is no conversation going on when the child is having food, because when they try to speak with a mouthful of food, that can lead to choking. Okay, because swallowing reflex, okay, chewing and for swallowing reflex is still developing in the kids who are infants. So it is very difficult for them. These are the problems in weaning. Diarrhea, lack of proper hygiene, okay, lack of proper complementary foods, um, also lactose intolerance. These sort of things will lead to diarrhea. And also, if when you're adding incorporating new food suddenly, okay, big quantities of new food suddenly, that will lead to diarrhea.